In this section of our series, we're going to talk about the diagnosis of eating disorders, types, and how they affect our systemic and oral health. In our last episode, we discussed the root causes of eating disorders and what we might see behaviorally in someone suffering from disordered eating. The most common eating disorders are anorexia, bulimia, and binge eating. That said, it isn't a straight line with eating disorders. Although there are many types, there are also many more combinations that could possibly be mentioned. It's common to see someone who's anorexic with purging disorder and all the combinations in between. According to bulimia.com, eating disorders are often characterized by an obsessive preoccupation with body image, a characteristic they share with another mental illness, namely body dysmorphic disorder. So here we are. Let me run you quickly through the eating disorder types and symptoms. Before I do that, though, let me first explain what determines whether someone's habits around food are classified as a particular disorder. What's known as the Bible of mental health diagnosis is released periodically from the American Psychiatric Association. This Bible is called the Diagnostic and Statistical Manual of Mental Disorders, DSM for short. This publication determines the set of criteria required for diagnosing specific mental health disorders. In the year 2000, the American Psychiatric Association released its 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. It's called DSM-5. This edition broadened some of the criteria for eating disorders so that less patients would fall into the cracks. Previously, many disorders fell under the broad umbrella of non-specified eating disorders. This made it especially challenging to treat people whose disorders didn't exactly meet the stringent criteria of full-fledged illness. One of the biggest changes was with anorexia nervosa, where the diagnosis is possible to give far earlier than with the previous criteria. The previous criteria required a person to be under 85% of their BMI, their body mass index, and required a person to have had 3 or more skipped menstrual cycles. Not everyone falls below a specific weight or ceases to menstruate. This leaves more up to the practitioner's clinical judgment, allowing people who suffer to get help before it's too far gone. It also recognizes that anorexia is not purely a female disorder. In regards to bulimia nervosa, DSM-5 ceased to differentiate between those who purge from those who engage in other behaviors. It's now common knowledge that there are often overlaps. Bulimia may present differently at different times and in different people. It has also changed the requirements from at least twice weekly for 6 months to at least once weekly over the last 3 months. DSM-5 granted binge eating disorder as its own entity. It was previously classified under the umbrella of non-specific eating disorders. Under DSM-5, the term feeding and eating disorders now includes what was formerly 2 separate disorders. It no longer differentiates between infancy, early childhood, and later years. We're trying to just get it to be more inclusive so people can get the help they need. Pica, a condition which causes cravings for non-food substances, is now classified under feeding and eating disorders under that umbrella. Avoidant restrictive food intake disorder, and we're going to talk about all of these a little later. That's a condition where those suffering are unable to take in enough calories to sustain life or energy. That now has its own category. There are many different types of eating disorders, including anorexia nervosa, bulimia nervosa, binge eating disorder, or BED, body dysmorphic disorder, or BDD, avoidant restrictive food intake disorder, pica, rumination disorder, and there's other specified feeding or eating disorder. I'm going to add orthorexia here. There's a lot of banter about whether that should or should not be included. My guess is in the next DSM it will be. So it doesn't right now have its own classification, but the dialogue is there. Many people with orthorexia just have stringent ideas of what food is pure, and it makes it really hard to eat. Being concerned about food ingredients everywhere, it makes it really hard to eat out. Again, some have been reclassified, but let me quickly take you through them. Please forgive me, but I'll be changing up the order. Since so much starts with, and so many can relate to, body dysmorphic disorder, I feel compelled to start there. So what is body dysmorphic disorder, BDD? Like I mentioned before, many times body dysmorphia is at the root of our eating disorders. Those suffering from body dysmorphic disorder tend to fixate on flaws and perceive flaws. This ends up taking up a lot of room in our thoughts and schedules as we try to do all we can to compensate for what we see as earth-shattering flaws, imperfections we become desperate to hide. What we often notice is that most afflicted tend to fixate on the desire to be thin. That said, sometimes there's a great need to get bigger, stronger, more muscular. We mentioned before, usually in males. Just to clarify, the desire to get fit or exhibit self-control is an admirable one. Issues regarding food only become problematic when they take over real estate in our brain, when they compel those who are out of balance to perform food rituals involving food monitoring, obsessively checking themselves in the mirror, usually from various angles, when it interferes with socialization, either due to the uncertainty of what will be served at the social setting, and or because of the need to hide food, eating in solitary, removed from the watchful eye of others. You get the drift. Those afflicted may or may not be aware of how exaggerated their self-debasing fixations are. It all becomes a hauntingly familiar refrain. At times, those around the person may consider them to be vain or selfish, as they're often looking in the mirror, evaluating and adorning themselves, making sure to look their best, or what they think is. I have a magnifying mirror in my bathroom and one in my cabinet of my operatory, eye level, so when I go to grab my floss, I can see if my eyeliner is smudgy. You might see people who seem to always have their look all together, yet you may not know where all this comes from. I have some drop-dead gorgeous cousins. They spend more time fighting their inner critic than you could ever realize. Some with body dysmorphic disorder seek surgical corrections, but usually with very little relief, since they continue to hone in on the other flaws. This may lead to a series of surgeries, depression, anxiety, and the avoidance of social activities. Let me tell you, it can take a very long time to get out the house when your inner critic peers back at you, judging you to be unworthy. According to the Mayo Clinic, signs and symptoms of body dysmorphic disorder include being extremely preoccupied with a perceived flaw in appearance that to others can't be seen or appears minor, strong belief that you have a defect in your appearance that makes you ugly or deformed, belief that others take special notice of your appearance in a negative way or mock you. I always tell people, especially here, we live in Jersey, it's like very likely no one's looking. Engaging in behaviors aimed at fixing or hiding your perceived flaw that are difficult to resist or control, such as the mirror checking, grooming, or skin picking. Attempting to hide perceived flaws with styling, makeup, or clothes. We all do this. It's when it gets out of balance that we have to worry. And constantly comparing our appearance to others. Frequently seeking reassurance about your appearance from others. Do I look okay? Are you sure? How's my stomach? How's this? There's a sign. Having perfectionist tendencies. Seeking cosmetic procedures with little satisfaction. And avoiding social situations. Remember the story of my mom and realize there's a disconnect between what we know and what we secretly believe to be true. I have seen extremely confident people who were not particularly beautiful on the outside, as well as intensely insecure people who are enviably as close to perfection as we can get on this earth. Go figure. Then there's binge eating disorder, BED. Can anyone relate to this one? Am I the only one who could polish off a pie single-handedly, even when I just promised myself that I will just have one slice? The best description I found of binge eating disorder is from the National Association of Anorexia Nervosa and Associated Disorders. It's a nonprofit 501c3 organization which provides free peer support services to anyone struggling with an eating disorder. They give the following definition of binge eating disorder, and I quote, "Binge eating disorder consists of recurrent episodes of binge eating. People struggling with binge eating disorder might eat much more rapidly than normal. Eat until uncomfortably full. Eat large amounts of food without feeling physically hungry, or feel guilty, disgusted, or depressed after eating. These behaviors must be present at least once a week for 3 months and be accompanied by feelings of guilt, shame, or depression in order to be diagnosed. You need both." As noted by the National Eating Disorder Association, another great resource, binge eating is also associated with depression, guilt, and shame. Let me now take you through the most common types of eating disorders, which also are those responsible for the majority of hospitalizations. They're also the most treatable, so that's good news. What is anorexia nervosa? Anorexia literally means without appetite. Anorexia nervosa is an eating disorder characterized by an intense pathological fear of gaining weight or becoming fat, including long after goal weight has been achieved. The feeling just doesn't stop when the weight drops. The overly restrictive eating patterns that ensue cause those afflicted to withhold calories from themselves. They're just unable to see the reality of their current weight, even as the weight plummets and it drops dangerously low. They still can't see it. This obsession with denying oneself may extend to include other self-destructive behaviors, including cutting, drug use, anything that just makes us feel badly about ourselves, a way to punish ourselves. Anorexia nervosa, including anorexia with purging disorder, is the main cause of hospitalization for disordered eating. Bulimia is the second most common eating disorder. It involves a recurrent cycle of binge eating and desperately attempting to compensate in one way or another. This includes fasting, induced vomiting, laxatives, diuretics, or other medications. Basically, behaviors which become excessive at best, extreme at worst. Many who suffer from bulimia present with weight and BMI in the normal range. So again, remember, you might not see it. I told you a glimpse of my story, the binging and the bailing. Those who suffer from bulimia are just as obsessed with their body image as those with anorexia nervosa. But the struggle of those with bulimia includes the self-defeating feeling of never being in control of our body or eating habits. Remember, I was jealous of my mother over her anorexia. Binge eating disorder, remember that from above? This is like binge eating disorder on crack. Now, I say that tongue-in-cheek. It is really important that we do not minimize any level or type of disordered eating. If it's negatively impacting someone's life, it's important, and help is needed. We don't want eating disorders to be seen as a competition or of one being worse than the other. The last thing people need is to avoid seeking help because they think their disorder is not as real as someone else's. Those suffering from avoidant restrictive food intake disorder are unable to eat in a way which their nutritional needs are met. We see weight loss or the inability to gain weight, lack of growth, nutritional deficiencies, and reliance on nutritional supplementation and/or tube feeding as common problems with avoidant restrictive food intake disorder. This is different than someone just being a picky eater. I really don't like those labels. With avoidant restrictive disorder, there's fear of choking, vomiting, or some other adverse event like an allergic reaction, coupled with an inability to take in enough calories to sustain weight or energy. Those who are simply picky eaters, I prefer particular. They might avoid textures or entire food groups, but they're able to maintain both weight and energy. So that's okay. Let me give you some examples of disorders now falling under the feeding and eating disorders umbrella. Pica involves eating non-food substances that have no nutritional value for at least 1 month. Cravings for substances like ice, dirt, rocks, clay, paper, or raw starches like uncooked rice are common, as are vitamin and mineral deficiencies. Pica is often seen with those suffering from autism, but the symptoms must take place for more than a month to be classified as an eating disorder. Rumination disorder consists of repeatedly regurgitating or spitting up one's food, then rechewing and either swallowing or continuing the cycle. The behavior pattern of spitting out, rechewing, and reswallowing food must occur for at least 1 month before being classified as a disorder. So what is other specified feeding or eating disorder? I cannot state enough that eating disorders don't fall in clean lines. So according to the National Association of Anorexia Nervosa and Associated Disorders, other specified feeding or eating disorders occur when someone meets some but not all of the criteria for an eating disorder. That said, risks of death, medical complications, and disordered body perceptions are just as real with this classification as with anorexia or bulimia. Here are several examples of other specified feeding and eating disorders. Atypical anorexia nervosa occurs when someone exhibits the symptoms of anorexia with a weight at or above a normal range. Binge eating disorder with episodes that are less frequent or do not occur as long as needed to be formally diagnosed, these fall under this umbrella. Bulimia nervosa that's less frequent or did not occur as long as needed for the full diagnosis. Purging disorder that occurs when someone purges without the binge eating. Night eating syndrome, when a person consumes at least 25 of their daily intake of calories after the evening meal. As you can see, eating disorders and the people they represent can come in many shapes and sizes. A one-size-fits-all approach is rarely effective. Stay tuned for our next and final episode where we'll explore treatment options and the oral and systemic health effects. We'll also explore how we may help, both as lay people and practitioners. Thanks for watching. I'm out.